Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Hi everyone, welcome to Forward Ever, Leading in Challenging Times. Glad to have you with us today because our guest is someone many in Hays will know, many across the state of Kansas will know. Terry Seek is the new Clinical Services Director for the Kansas Hospital Association. Joining Terry, you can see it's Cindy Samuelson, who is the KHA Senior Vice President for Public Relations. You know our show focuses on leading in challenging times. And those that work in healthcare, I think it's a challenging time every day, and our guests certainly do. Last summer, the Kansas Hospital Association welcomed Terry Seek as their new Director of Clinical Services. Before joining the KHA, Terry was the Vice President of Patient Care and Chief Nursing Officer at Hays Med here in Hays, Kansas. Terry, great to have you visiting with us today.
Great to be with you, Gary.
Tell us about your new gig. What's going on? What are your new responsibilities? And does that bring you back to Hays?
Yes, my new responsibilities here at the Kansas Hospital Association are very broad. As the Director of Clinical Services, I'm working with quality projects, safety projects, workforce development, behavioral health, maternal health. So all those things that I worked with before on a local level, and now I get to work with them on a statewide level. And it's been very interesting as the last 5 months, I'm still drinking from a fire hose. There is a lot of great work done here at the Kansas Hospital Association, and we have a lot of experts in-house. It's a small but mighty team. We have 30 people on staff, and if you need to know anything about healthcare and especially how it affects our hospitals, this is the place for you to come to find that out.
Well, I'm going to switch over to Cindy, and congratulations on the new spot, Terry. But Cindy, tell us about the Kansas Hospital Association. Many of us have heard of it, but why is it important and why is this new position as Director of Clinical Services necessary?
Well, as many may know, the Kansas Hospital Association represents all the community hospitals in Kansas and other healthcare organizations. So that's 124 community hospitals across the state. We've been around since 1910. So we've been a long-standing organization in the state of Kansas advocating for hospitals and healthcare in our state. This position is really exciting for us because there's so much important work happening in quality and safety efforts. To have Terry, with his extensive experience, join our team to really help lead some of the things we have been doing, but some new things too, has just been a really good move for us. Like he said, we're small, but we really think of ourselves as an extension of the hospital staff across the state, doing the things that maybe they can't always do because they're taking care of patients in every community. So we're really helping them do their job.
Cindy, with the size of hospitals, that has to be a challenge because if you look at the hospitals in the state of Kansas, you have great big, I'll say the big community hospitals like in Kansas City and Topeka, Wichita. Then you also have those that are in the smallest corners of our state, whether it be Waukene or Oberlin, or you go down to Southwest Kansas. There's a wide range, and I'm assume that the services may be more helpful in the smaller hospitals. Am I wrong about that?
Well, I think you might be hitting on hitting the nail on the head in some sense. We have 124 hospitals, 83 of them are critical access hospitals. As you mentioned, those are less than 25 beds inpatient. But we do also have 3 even smaller hospital type facilities new to this state, if you will. They're called rural emergency hospitals, and they're more of like a only outpatient type service hospital with a robust ER. So they're also smaller facilities. And then we have our what we call PPS hospitals, Prospective Payment System hospitals. And those are the bigger hospitals you mentioned. There's 38 of those. So we do have services that really help all the hospitals across the state. When we advocate for things like better reimbursement, that impacts every single hospital in Kansas. But there are probably some things too that a large hospital might have already set up with their electronic health record or potentially a quality effort. But a smaller hospital may need a toolkit or some support. So we do a lot to help them be able to do everything a big hospital would be able to do that has maybe a more robust staff.
Terry, I'm going to come back to you in a second, but Cindy, when you're talking about the financing of hospitals, there's been a whole bunch of financial issues across the state. And both the little hospitals and even the big hospital, I don't think anybody's out of the woods as far as being able to be financially solid in today's environment. How does the hospital association play into that role? I know you always look to get more money, but sometimes that's not a straight path either.
Yeah, so stagnant reimbursement is a huge issue for hospitals across the state and the nation for that matter. So Medicare, it's a big part of what people in Kansas have for coverage, and it does not pay and reimburse hospitals for the cost of that care that Medicare patients receive. Same for Medicaid. And we're seeing more and more in commercial payers also not paying the full price of the cost of care. So that stagnant reimbursement that everything else goes up in time, everything we pay for, whether it be groceries, milk, electricity, and every little thing a hospital needs to continue to function goes up in price, as people know, because they experience it in their pocketbooks too. But the reimbursement we get does not trend in that direction. So hospitals have to feel, big and small, have to figure out what they're going to do with less reimbursement regularly.
And Terry, you fit into this role in a certain way because you're working with the hospitals and how do they be more efficient and yet take better care of patients. Everybody wants better care than they had the last time, and nobody likes to go to the hospital and walk away going, that was a bad experience. So you have to work on both sides of that to get a good experience. You have to have people, you have to have all the right things. How does your new role at the Kansas Hospital Association play into this?
First off, in the quality realm, which is what you were talking about, I work with the Quality and Safety Committee and the Kansas Association of Risk and Quality Managers. And we are always looking at the quality measures that are being proposed and how do we help our members meet those quality measures as they come out. And also, how do they report those? And we have a division here, our data division. A lot of the hospitals participate in submitting the data to them, and then they help make those reports and get those out so they go to the right agencies and they get the reimbursement that they're eligible for based on quality. And then workforce, yes, workforce is something that we are very involved in, workforce development. And especially for me on the nursing pipeline, I do a lot of work with schools and employers and also the Kansas Nursing Workforce Center. And how do we bring all that together to strengthen that nursing pipeline and make sure that we have nurses for the future? And that pipeline starts at the CNA level and goes all the way through the nurse practitioners. So how do we help with all of that? And we also work with the Kansas Board of Regents on things like that. So there's a lot of coordination that happens here that between all those different entities that we work with.
I know you have over 30 years of nursing. I don't know how many over 30, but you've been in the nursing from bedside to a nursing executive. Do you miss the nursing work, being at the bedside of a patient?
Yes, every day. When I was the CNO, I was able to go to the bedside on rounds and do those skills like help people and answer call lights and do the foundational things of nursing. But I miss being at the bedside. But I also know that I'm influencing what's happening at the bedside. And that's what I've done in the last 20 years of my career. And what I'm doing now is if I can help somebody with one of those quality measures do better at taking care of a patient, then I'm still at the bedside. I'm just a couple of 100 miles away from it.
So I'll answer, you guys can both answer this, maybe from separate chairs, but this because I don't know. And the question is, are people excited when you walk into their hospital? to say, I'm excited to see you. We're looking forward to your help. How
Well,
does it
I've
feel when you
been,
walk in there?
yeah, I've been here at the Hospital Association 24 years. And before that, I worked at a hospital like Terry did here in Topeka, Kansas, Stormontville Health. And so I've been on both sides as Terry can experience as well. And I really do believe we think and our members think we are an extension of their team. So when we're coming to the hospital to help them out, that's what they see it as. KHA, is here to help or learn because a lot of times we're going out to really learn about the issues front hand because Terry and I both aren't in that clinical setting every day now. And so we really need to have that experience with our members. So they appreciate us being there so that we can better work on their behalf. But also generally we're coming to help. So it's just more support. So that's my feeling. Terry, what do you think?
I feel the same way. It's actually been a breath of fresh air being here. And when somebody calls or you call them and they are open and honest and want to talk about what the issue is and make sure you understand it from their perspective so you can help them or you can just support. And that's been a, a big thing that's made me excited about this job.
There's a teeter-totter effect of it. There's one ends where you just go in and you put out fires. We have a problem here, so how can we help? And on the other end is say, how do we have some initiatives that help in the future? How does the teeter-totter work there for you guys? Is it some of it or some of both?
Well, and I'll chime in first and then Terry can jump in. But another really important part of the association that I think we're really lucky about in Kansas is the collaborative nature of the work we do. Every single hospital is a member. So unlike some states where not everybody is on board, like you said, sometimes there's urban and rural issues and they're not the same. We have everybody working together, really interacting together. We find ourselves very codependent on each other. We need rural, we need urban. And so I think the collaboration that hospitals know they're not alone. One hospital's issue is not, it might be specific to their hospital, but many people are dealing with that issue. So I think that collaboration effort has been something that doesn't feel like a teeter-totter as much because everybody knows that we're here to help all of them at whatever level they're at. So I don't know what you think, Terry, but
And in that collaboration for that teeter-totter, it's also knowing who's doing what. So if we have a member that is struggling in one area, we usually know a member that's succeeding in that area, and we can join those two together, and they can actually talk about it from their perspectives, and that helps them as well because we're not going to come in with all the answers, but we have the knowledge of what other people are doing. So we can connect them, they can get together and they can work on those issues together, which helps with the teeter-totter effect.
The other thing on that is financing. If you don't have the money to pay enough people to help, that's a challenge for everyone. And when you're when you're in patient care and you're the patient, you realize no one's here to help me, and that's sometimes because there's not enough help there to do that. And you play a role in that as well. I know there's been some additional funding that's been kicked in the last few months. Will that make a difference?
yeah, you're talking about the Rural Health
Hmm.
Transformation Program.
Hmm.
And so we are really excited about the opportunity that we'll have here in Kansas with that program. It's really going to be innovative. I mean, the whole point of the work is to be innovative, and the whole point is rural focused. But every hospital in the state we think is going to benefit from this program. Kansas put together a really good application in a short amount of time, asking for $200 million. And we were really pleased to learn that we got more than we asked for when we applied. So we got 221 million plus, almost $222 million, the sixth highest amount that any state in the country received to help with this rural health transformation work. So we're really excited about the opportunities that'll be here very soon over the next 5 years. And that's the dollar amount we got for year one. So if we do a really good job executing the ideas that were in the Kansas application, we have an opportunity to get that amount of money again. And that's, I said, for every year for 5 years. So a lot of interesting and exciting work that we can talk about if you're interested that will be a help. It does not replace, if you will, negative margins that we receive, like lack of payment from Medicare or Medicaid or insurance companies. It doesn't fill the gap of rising workforce costs for staff, but it does really help hospitals in rural areas do some of the work they want to do to really have a long-term effect for great quality and patient safety efforts as well as workforce staffing and other issues.
Would there be an example of what that money would be used for efficiency standpoint?
I don't know if you want to talk about a quality one. I can talk about like an example of one, just one example that in the early application here in this year, they're going to be looking at two areas of focus to start. And one of them really has to do with, if you will, kind of that collaborative regionalization effort. So hospitals will be able to do some work together. So examples of something might be a set of hospitals that are in close proximity in a rural area. Maybe they want to bring on a specialist, somebody that can do hand surgery or something, something that they've never had that they really need, or wound care, something. And so they could work together to do that. And there would be funding, not to support the staff member, because the program dollars won't go to anything that's already covered by Medicare or Medicaid, but to really build the program, to establish the contract, to do whatever they need to do to get that happening and functioning in their area, which would then be sustainable for years and years to come. So that's one example. Another example might be a hospital. We talked about rural emergency hospitals. So some of those hospitals, well, all of them, were built as a full service hospital where they had rooms set for patient beds where people slept overnight, and that's not the case for these hospitals anymore. They're mostly outpatient services, really. So how can they convert those spaces to do more of a clinical setting, if you will? There would be funds to help transition that space to something more functional for today's world, when a small rural hospital that was struggling anyway wouldn't have had the resources to make that space work for not a long-term stay, but a short-term stay. That's a couple examples. I don't know if you have anything else you want to highlight, Terry.
In quality, they have the value-based program, and that goes in two different spots. One is in the hospitals. There's 5 quality metrics that'll be tracked, and hospitals can receive money for meeting metrics within those 5. And those 5 actually build upon work that's already been done. So there's a metric in stroke, there's a metric in cardiac care, there's a metric in sepsis care, and then there's one in diabetes and heart failure. So that collaborative will be working together to help the hospitals meet those and also receive that incentive payment. And then on the workforce side, it's strengthening and continuing work that's already been going on with preceptor development and apprenticeship development and nurse residency development. So not only do we have the healthcare workers that start in Kansas, but what can we do to help retain them? So apprenticeship is recruiting and making sure they get started in the right way. Residency also makes sure that they want to stay. And then making sure that you have a qualified preceptor that's actually been trained to be a preceptor is one of the factors that plays a part in that as well.
Well,
And I might just, oh, sorry, Gary.
Go ahead, Cindy. Go ahead.
I wanted to note that, some people do get confused about the dollars in the sense that they're not just for hospitals, they're for rural health. So there's others that could get it. So one example he mentioned was those quality measures. Hospitals, if they meet those 5 measures, which we know they're all working to do already, these are just some specific best practices, if you will, that they can meet to do the best quality healthcare. If they do that, there's $50,000 a quarter for those hospitals that receive that. But then if there's a rural health clinic, that's not a hospital, it's a clinic. They get $25,000 a quarter to hit those. And it really helps them over 5 years. That'll be significant funds to help on those quality efforts, which will then be second nature and improve quality health care across the whole state. So we're really excited about those. That won't be a heavy lift, but they'll really move our hospitals to that level that everybody wants to have, which is the highest quality of care.
Sounds like it hangs a carrot out there to be the best you can be. And if you do that, you get a bonus for doing that. So, you know what? You guys are both nurses, or were nurses.
Actually, I'm not. I was in the hospital, but not as a nurse. Terry,
not as a nurse. Terry was a nurse. Terry, I want to talk to you about the changes in nursing because, And some things have changed a bunch. Some are still the same, taking care of patients. I'm going to ask you that question when we come back here on Forward Ever, leading in challenging times. Thanks for being on our program. It's brought to you by Worth Wealth Management. We'll be back after this.
Since 1776, the United States of America continues to stand tall. It's been tested before, many times. Through grit and the ability to move forward, we create better tomorrows. We help our clients live their best lives to and through retirement. We make it easier. Thank you, Kansas. Worth Wealth Management, enhancing lives and strengthening families.
Welcome back to Forward Ever, leading in challenging times. We're talking about healthcare, and we're talking about how the role of nurses has changed and some of the many things that are going on in the hospital with the Kansas Hospital Association. Terry, this question specifically for you. You've been a nurse for a long time. We talked about that over 30 years. How has that changed from when you first started to where it is today, that role?
I think basically nursing's the same. It's always been the same. What has changed is the burden of paperwork, the burden of the oversight, the things that you have to make sure that you get documented on a daily, minute by minute basis. And there's a lot of exciting things that as we look forward into the future of nursing. That will help with that. We've been using ambient technology to document doctors. We started using ambient technology to document what happens in a doctor's visit. That is now being beta tested in nursing. So when I'm at the bedside, instead of me needing to concentrate on my computer and put in what I need to put in, I would be able to narrate my care. And by narrating my care, the AI would hear it. They would put the appropriate responses in each of those boxes, and then all I need to do after that encounter is edit it. So I would have more time with the patient, less time with my technology. Another huge thing is technology has changed tremendously since I came out of school, but most of the technology advances have been for the advantages of the patients.
Well, you see that, and you go to the old Star Trek shows and you watch, and they wave the wand over and the chart comes up and say, here's what's wrong. We're a ways from that yet, but sometimes when the caregivers walk in, you see the big computer that comes with them and all that sort of stuff. There's a lot of technology that's making a difference for those of us, and especially in some of the smaller areas where that technology can connect to the bigger hospitals or the regional hospitals and be able to help with some of the care along the line. And Cindy, I'll finish up with this with you and the Hospital Association working with all of them. I'm sure that's on your list of how do you help everybody work together better.
Yeah, so the patient care is essential. As Terry said, it's the most important thing that we do. The staff that work in hospitals are the most important resource a hospital has, period. So, I mean, it is a very focused area of the work that we do, but there's a lot of other things around supporting the staff that need help too. And that's advocacy efforts, that's education, that's data, that's communications, that's all those other things. So I think the association is really a good partner and that we can do a lot of that work so that our hospitals and our clinicians across the state can really focus on the patients.
Cindy, thanks for joining us. Terry, good to see you again, and thanks for being here and taking the time to visit with us here on Forward Ever. Healthcare touches all of us. And I have a 92-year-old mom and have kids and grandkids. It touches all of us, and we appreciate the work the Hospital Association does. Thanks for being here today.
Thank you.
Our guests joined us talking about healthcare. It's Cindy Samuelson and Terry Seek. If you're out there listening, you can go to, and I'm going to go back to you, Cindy, what is that site for the Kansas Hospital Association?
Yeah, it's kha-net.org.
Okay, and what's that all stand for? Because there's a lot of letters in that.
It's the Kansas Hospital Association, KHA-net, that's on the internet, .org.
Okay, perfect. Thank you guys for joining us. And thanks for listening to Forward Ever, leading in challenging times. It's brought to you by Worth Wealth Management. and we're enhancing lives and strengthening families. Appreciate you being on the show. Thanks for listening. I'm Gary Shorman.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.